Hi everyone, I am Stephanie with 9Health. I am live today from a Quest Patient Service Center. I'm at the one in Inglewood off East Hamden, adjacent to Swedish Medical Center. And we want to go live to show you, well, you need to wear a mask when you come in here. Mine keeps falling off my nose, so maybe a better fitting one than I have. But when you come into a Quest Patient Service Center, you will check in. You can now get preventive health screenings, the 9Health preventive screenings at a Quest Patient Service Center, along with COVID-19 antibody testing. So we're pretty excited because we had to cancel the spring 9Health fairs, but now we're trying to provide those screenings to you. So I want to introduce my experts with me. I have Dr. Bill Becker. He is with Quest Diagnostics. And of course, 9Health expert, Dr. Pal Coley. Ask your questions on Facebook. We'll get those answered. If you have any questions about what screenings you can get, what it looks like when you get here, it's safe. You come in with your mask, stay 6 feet apart. I've seen a couple of people come in. It's really quick, at least at this location today. They're pretty quiet today, so that's nice. Again, maybe a better face mask than what I have because I keep having to adjust mine. But maybe you won't be talking as much either when you come here for just a screening. So first, Dr. Coley, people can now get things like the 9Health blood chemistry screening, hemoglobin A1C screening, vitamin D. Why is it important to get these preventive screenings?
So Stephanie, the reason it's really important to get preventive screenings is because preventive screenings help us to identify disease before it manifests itself. And many of these diseases are asymptomatic and until late in the course of the disease. For example, diabetes, a lot of people can have diabetes or pre-diabetes without realizing that they have it, or have problems with their kidney function, have low vitamin D, have low iron levels. So these types of screening tests really kind of help give us a wake-up call and change the trajectory of the disease early before it started to damage our organs and declare itself with symptoms. So it's really important to do those at least once a year in order to make sure that you're really looking for those problems before they happen.
And Dr. Becker, 9Health again has partnered with Quest Diagnostics to offer these preventive screenings, but also COVID-19 antibody test, the COVID-19 antibody test. Talk a little bit about what that is and who should get it right now.
Okay, yeah, hi Stephanie, and thanks for having me, and appreciate the opportunity to talk to your listeners. So let's break it down. What are antibodies? Well, antibodies are specialized proteins that our immune system make when we are exposed to bacteria or viruses and other things, basically anything that our body sort of identifies as normal. So with respect to COVID-19 then, antibodies in most people are going to start to form 1 to 3 weeks after the infection, and we can detect these COVID-19 antibodies in a blood sample, which makes it nice for detection purposes. So a positive COVID-19 antibody test means you've been exposed to the SARS-CoV-2 virus, and your immune system has responded by making antibodies. I should point out the COVID-19 antibody test should not be used by itself or alone for acute infection. That requires the molecular, the diagnostic test, which is the nose swab that everybody I'm sure likes. So the second part of your question was who should get a COVID-19 antibody test. There's several places where the results could be very useful. Number one, if you're asymptomatic and you think you might have been exposed to the SARS-CoV-2 virus. Now remember, it takes 1 to 3 weeks on average to make the antibody, so going in the next day probably isn't going to be a useful result. The AMA also suggests that if you're considering getting this test, you might want to talk to your provider first, and that's always a good idea on just about any health issue. The second place where COVID antibodies can be used is in public health. Public health is trying right now to see how extensive COVID-19 has spread in our communities and throughout the country. And they call that seroprevalence data. So knowing whether you're antibody positive or negative can help public health as we address this pandemic. The third way is COVID-19 antibody test plus PCR, the nasal swab, can be used together for people who may have had symptoms for like 9, 10, or up to 14 days, where the diagnostic test, the nasal test, may be negative, but the antibody test might be able to turn positive. But remember, you don't do the antibody test by itself, but in conjunction with the nasal test, it can be very useful. It can be very useful in kids, too, in that manner. There's other uses, but I think you've got a question for Dr. Coley that'll talk about an important use right now.
Right, so Dr. Coley, talk about a little bit more about what the information people can do with their antibody test results, the COVID-19 antibody test results. It's not really an immunity passport, but it may benefit the community.
Absolutely right. So as Dr. Becker just pointed out, what this tells us is that your immune system has seen this virus and that it's mounted these antibodies against this virus. What we don't know in the scientific community at this time is whether or not these are the right type of antibodies, those neutralizing antibodies that'll actually protect you from a future infection, whether there's enough of those antibodies, because this is just a qualitative test, a yes or no test. It doesn't tell us how many antibodies you have. And we also don't know how long these antibodies are going to last, whether they're going to last a few months, a few years, or for the rest of your life. So I think because these are all outstanding questions, we have to be really careful about interpreting a positive antibody test as an immunity passport or a license for you to go out and not be as cautious when it comes to protecting yourself and protecting others. Because there is some data that some people may have prolonged positivity and or test positive for the virus more than one time. So there's case reports at this time, so it's nothing compelling, but there are some case reports that say people have potentially been infected more than one time, or some people may not actually mount an appropriate antibody response. So I would just really interpret this as a sign that your immune system has seen the infection, that you had this infection, and that you've recovered. And then to Dr. Becker's point, from a public health perspective, it helps us to know that this virus was in your community, that you're one of the members of your community who, contracted the virus and recovered from it. And that helps us to plan our public health response accordingly.
Right, and again, someone just asked why I'm wearing a mask and breathing in my own CO2. Again, it is safe to wear a mask, but I am at a Quest Diagnostics Patient Service Center. Again, just showing people what it's like if you come in to get the 9Health preventive blood screenings or a COVID-19 antibody test through 9Health. We've partnered with Quest Diagnostics to make this possible, make it affordable. The antibody test is $79. You'll find the prices for the blood screenings on our website, but they're the same prices that you would get at a 9Health fair. So $35 for your blood chemistry, again, gives you 28 points levels of information. So Dr. Becker, speaking of that, so the blood chemistry gives 28 levels of health information. We also have a vitamin D test, and it's common for people, even in our state with all the sunshine, to not have enough vitamin D. So what does vitamin D do in our bodies, and why is it important to check during the COVID-19 pandemic?
Yeah, Stephanie, that's a great question. And as you mentioned, vitamin D is called the sunshine vitamin because we actually make vitamin D through when we get sunshine exposed on our skin. I have to stop though. The most important function of vitamin D is to help the body maintain normal calcium and phosphorus levels. So it aids the absorption of calcium, which helps us maintain strong bones. That's absolutely the most important function of vitamin D. Now, some of the other ways that vitamin D helps us, we know that a deficiency of vitamin D increases our susceptibility to respiratory viruses like colds and flus, and the literature seems to indicate COVID-19 fits in this very well. So having a normal vitamin D level helps us have a healthy immune system. So vitamin D has many other functions. Dr. Coley could certainly talk about it. It affects on blood pressure and it has effects on other organs as well. But for this conversation, the two most important functions of vitamin D, bone health and a healthy immune system.
And again, you can get that vitamin D screening when you come into a Quest Diagnostics Patient Service Center. Dr. Coley, another screening people can get for their blood type. Why is that important? And talk about the study that relates blood type and the risk for severe complications due to COVID.
So the blood type is really the markers that are on our red blood cells, and everybody has a different signature. And there's three groups. It's A, B, and O, and then you can either be positive or negative. And so there's about 6 different blood types out there. And it's really important to know your blood type for a number of different reasons. So first, in general, it's important to know in case you're ever in an accident or anything like that, or you need to give a family member or a friend blood, it's helpful to know what blood type you are. But second, and as it relates to this COVID-19 pandemic, there was actually some data out of China that certain blood types may be higher risk for having worse outcomes with the infection. Now, that data was subsequently confirmed with a genetic study that was published in the New England Journal of Medicine. It was called a genome-wide association study. And they basically looked at individuals that contracted COVID-19 and had severe cases and compared them with controls in other countries. And what they found is that some of the genetic signatures that were markers of maybe having a more severe case actually localized to the chromosome where your blood type lives. And they actually found an association with the A positive blood type of 45% higher risk with COVID-19. And with the O blood type, they found a protective effect potentially associated with a 35% lower risk association. Now, there's been another study that's come out since then that just came out yesterday, actually, that sort of debunked what this study showed. So the data is still evolving on this, and you can see we're riding the science roller coaster up and down. But it seems that blood type may play a role in our susceptibility to complications from COVID-19 infection and may end up being a marker of risk. So it is something for us to know.
Yeah, so another good screening to get. I put the link to register for screenings in the comments. You register for screenings on our website, and then you make an appointment at a Quest Patient Service Center. Again, that's why I'm wearing a mask. People are saying, why is she wearing a mask? She's not within 6 feet of anyone. I want to be sure to be safe in case anyone comes through that door and wants to come get screenings that I'm wearing my mask, because you're your mask when you're in here. So Dr. Becker,
can I just make a comment about the mask too, Steph? Even if you're not within 6 feet of each other, because what we're trying to protect others from are droplets, right? When we sneeze or cough. But we know that aerosols, which are basically tiny droplets that can occur even when you're breathing, or just sitting or talking, can linger in the air for up to 3 hours. So it is important for you to wear a mask even when nobody else is around, if you're in an indoor space, because those aerosols could linger long after you leave.
Thank you. Yes. So thank you for defending my mask wearing, because that is why I'm wearing a mask. Again, I'm not in my home office like I usually am. I'm out in public. I'm in the Quest Patient Service Center. Dr. Coley, we did have someone ask real quickly, and either one of you could answer this, but I did ask Dr. Coley the benefits of getting an antibody test for our community. Someone asked, can the antibody test help identify people who can donate plasma? Maybe talk about donating plasma after an antibody test.
Yes, that absolutely can. And, convalescent plasma, which is taking the antibodies from a person who's recovered and injecting them into somebody who's sick, is something we're still exploring as a therapy. There is a New England Journal of Medicine article that looked at this as a therapy, and it seems to be trending in the right direction, but we just need a bigger data set to know for sure that there's statistical power. So that is absolutely another reason to get that test, is to identify those potential donors. And if you are antibody positive, you should strongly consider reaching out to the blood bank and seeing if you could be a donor for your plasma, because it can really help somebody else.
Yeah, so that's another benefit to it as well. And Dr. Becker, I don't know if you want to add to that, but then also I want to ask you just what Quest Patient Service Centers are doing to keep people safe if they want to come in for these screenings, some of the precautions being taken. I've kind of shown here, wear a mask, stand 6 feet apart when you register. Again, the location I'm at today is pretty quiet, so that's nice as well. But just talk about some of the precautions Quest is doing to keep people safe.
Okay, yeah, great question, Stephanie. Thanks. I'll take the question actually in 2 parts. What's Quest doing, and then what can you do when you go to a Quest Patient Service Center? So first of all, what's Quest doing? Safety is always number one for us. We want to make sure that you always have a safe experience when you come for a blood draw, or if you're giving a urine sample, or whatever reason you're presenting to our patient service center. So we always have safety in mind. We've added some extra things that add to our safety practices. We have something called Wait by Text, where you can wait in your car and we will text you when it's time for you to come into the center. And that way, we don't have a lot of people, as you probably noticed in your screenshots, we don't have a lot of chairs in there anymore, and we don't want a lot of people waiting, and we want to make sure we follow all the social distancing rules that are out there. We will provide you with gloves if you want them and ask for them. We have special hours for anyone 60 years or older, if you're pregnant, or if you have any underlying chronic medical conditions, because we know that these are the patients that if they do get COVID-19 can have a really severe disease. And so we call this program our Peace of Mind program, so that we'll protect those hours during the day, and you can schedule them online with our appointment scheduler, so that we protect those hours for those special patient populations. We've been disinfecting all the surfaces, all the high touch points, surfaces even more frequently than we normally have been doing. And everybody's washing their hands more frequently, just like we're all being asked to do by our public health colleagues. So safety is number one for us, and we'll ensure that you have a good, safe experience in one of our patient service centers. Now, what precautions can you take if you want to come to one of our service centers? First, wear a mask, okay? You can schedule your appointment online, and you can pick the hour or hours that work best for you. I also want to remind everybody that we do not perform the COVID-19 diagnostic test, the nasal swab test, in our patient service centers. Those samples need to be collected by a provider, either your doctor, your nurse, your pharmacist, your PA, either in their office, or you can go to one of the community drive-through pop-up services that are around various communities around the country these days. So wear your mask, socially distance, appointment scheduling, wait by text, and we'll keep you safe.
Right. So if you're,
I just wanted to add just one thing to what Dr. Becker said, which is that because they're not actually doing the nasal swab testing in the patient service centers, the people that are there are not feeling sick. They're there for their routine screenings. And so that's very reassuring as well, because you don't have to worry necessarily that someone there could be symptomatic or, be there and spread the virus to you.
Yeah, and Dr. Coley, that leads me just to kind of this last little question. We'll kind of get wrapped up here, and unless there's any other questions people have. Most people are just commenting on why I'm wearing a mask if I'm isolated. Again, I'm at a Quest Patient Service Center. I do look like I'm isolated. There's just no other patients in here right now, which is good. So we can do this little segment and show you what it looks like. But people could come in here, and you want to be wearing your mask. And like Dr. Coley said, my droplets that come out of my mouth can hang out in the air for hours. So I want to make sure those droplets are staying with me, not going out in the air. But Dr. Coley, when COVID first started, we were telling people, reschedule those preventive appointments. It's not important to get that right now, but we're in this for the long haul right now. It's kind of a marathon, not a sprint. So why is it important to get those preventive screenings right now to know our baseline of health? And then what else should we all be doing to be the healthiest versions of ourselves?
So it is really important now because, as you pointed out, this is not a mode we're in now just for a few weeks as we were back in March. This is going to be us for the next several months, if not 1 or 2 years, until the vaccine is really widely available. So we have to start thinking about prevention again, because the next wave of morbidity and mortality from this pandemic, from people who don't directly catch the coronavirus, is going to be those people who don't get their preventive screenings, those people who don't, we aren't able to pick up diabetes or heart disease or thyroid dysfunction or what have you. So it is really important to start shifting our mindset a little bit about prevention and focusing on that again. And that's the reason 9Health and Quest have really partnered to try to make this a safe and completely enjoyable experience for you, where you can start to think about your preventive health again as we switch into this maintenance mode of kind of living alongside the virus, because it's not going away anytime soon. And your second question, Stephanie, was
just what else should we all be doing to be the healthiest versions of ourselves?
It is difficult during a pandemic to really focus on prevention, to get enough exercise, to get enough sleep, to keep our stress levels low. But all those things that we've talked about when there's not a pandemic still apply right now. So it is really important to maintain a healthy weight, to make sure that you're watching, the carbohydrate intake in your diet, the fat intake in your diet, to get those blood screenings to make sure your cholesterol level, your sugar levels, your thyroid, your triglycerides, your vitamin D, all of those are where they need to be. And to really try to approach this in a holistic sense and ask yourself, what would I do to be my best self if there wasn't a pandemic going on? And those are all the things you still have to be doing. And then on top of that, some more, as Dr. Becker pointed out, washing your hands and wearing those masks. And so it's almost like, we're hyper aware of our health right now. And I really think this is a good time for us to start thinking about prevention in a more global and comprehensive sense, because this pandemic has made us realize that prevention is so important. If we could prevent these infections, if we could have prevented this virus from, coming into our society, that could really have changed the course of things. So in a way, it's really taught us a lot of good lessons about, how to move forward and how to think about our health moving forward.
Yeah, and I'm going to let both these experts go. We got a little bit of a late start due to some technical difficulties. That's the world we're in now, but I'm glad both of you were able to join us and this worked out. To learn more about our 9Health Discovery Kit, you can go to 9healthfair.org/COVID risk. I'll put the link in the comments. I already did put that in the comments if you want to click on that and check out all the screenings. Again, you can also get the COVID-19 antibody test at 35 Quest Patient Service Centers across the state. If there's not a location near you, they're mostly metro, so if there's not a location near you, we also have 9Health at home. You can perform many of the preventive screenings at home, except for that COVID-19 antibody test. So to get that, you do need to go to a Quest Patient Service Center. And once you get your results from your screenings, you can call our 9Health Neighbors line, which is staffed by 9Health medical volunteers. You leave a message, they'll call you back within 24 hours. It's 303-698-4455, extension 2005. I'll put that in the comments as well. And so you have that, because you can call that anytime and ask any medical question, but it's also a good place to call when you get those results to talk them over and, you know, figure out what you need to do next, your next steps. So again, I'm at a Quest Diagnostics Patient Service Center. When you come in, you wear a mask, you stand 6 feet apart, check in. It's very simple, easy, quick. And Dr. Coley always says not to mess with your mask, and I keep messing with mine because it keeps falling into my face. So a better fitting mask than mine, maybe, but maybe you won't be talking a lot either. So which would probably be better because talking makes it fall off. But all right, I will let both of you go. Thank you so much for joining us again. Go to 9healthfair.org for more info. Thanks so much.
Thanks.